Hello, Dr. McAllister.
Oh, I'm sorry, Ken. I had you on mute. How are you?
I'm doing fine. How are you doing, sir?
Good, thank you.
Good. Where are you today?
We are in Connecticut, just up from New York City.
You're at Yale then, huh?
Yeah, we're at Associated Neurologists. I direct the Headache Center and Clinical Research, but I have an appointment at Yale as well.
Ah, okay. All right. Well, nice to have you on board. Talking about migraines today. Now, migraines are I've never had one. I don't suffer from them, but I know some people who do, and for them it's not fun. These are very bad things. Do we know what causes migraines?
Well, we know that it's strongly genetic. 70% of people who have migraines have a family member who also has it. But we also know that it's a neurological brain disorder. That is, it's arising from the brain, and it has to do a lot with some of the chemicals in the brain misfiring. And, about 6% of all men, but nearly 20% of all women have migraine. That works out to about 36 million Americans are suffering from light sensitivity, sound sensitivity, nausea, vomiting, severe head pain, and it's causing them to miss time from work or from school. It's causing them to have trouble taking care of their kids and enjoying quality of life.
Do we know why more women suffer from it than men?
Only that hormonal cycles seem to be a big trigger. So a lot of women have it around their menstrual cycle. It tends to get better once they stop having periods in their 40s or 50s. There's a thought that maybe we men are giving it to the women. That's another idea. But, it's about 3 to 1 female to male. And there are a number of other medical conditions that also have a preponderance of women, such as lupus and multiple sclerosis. So migraine isn't the only one.
Do we see more? Do we see more older people having them, or can it strike? I guess it can strike at any age, can't it?
Sure. I've got young grade school children, and I've got very elderly who have migraine. But the typical group we're talking about here is 20s to 50s, and that's important because that is the prime working years and the prime child-raising years. So if you are knocked out a few times a month, you're going to be calling in sick to work or have trouble taking care of your children. Now, there exists within migraine a sort of worst-case scenario, and we call that chronic migraine. That's about 3.2 million Americans. And they're not having 1 or 2 or 3 headache days a month. They're having 15 or more headaches a month. That's half the month or more. They're in some sort of headache, 4 hours or more in duration, and they're having these migraine symptoms with the light and sound sensitivity, the nausea, the vomiting, the concentration trouble on at least half of those days. So this is a condition that causes extraordinary disability, missing time from work and from school and basically from life as you kind of shut down for half the month while you're in this phase of the migraine.
Mm-hmm. Are migraines easily misdiagnosed?
Yes, they are both underdiagnosed and misdiagnosed. Sinus infection, needing your glasses checked, dental difficulties are all neck pain are all misdiagnosed when really all those conditions could well be migraine. If you look at the chronic migraine group, the 15 or more headache days a month, it's been estimated that about 80% of people who actually have chronic migraine are not diagnosed. So this is a group that's really in need because they're trying to treat their headaches on their own, and they're going to pharmacies and getting over-the-counter medications and trying what they can, but if they were diagnosed properly, they would be able to get proper treatment.
And now I know there is, speaking of treatment, Botox has been, it's not just cosmetic anymore. I know a friend of mine who gets Botox shots for a nervous twitch he has, but they're now being given for migraines too, huh?
Yeah, it's interesting. Most people know about it from cosmetics, from a state a little bit to the south of you in Washington. That would be California, right?
Yeah.
But as you said, your friend treats his twitching muscle, and I treat those patients. A neck twisting condition, stroke spasticity of the upper arm, excessive sweating, all can be treated with Botox. So it's a very interesting medicine. And it was discovered rather accidentally that when injected into the head and neck area, can reduce the number of headache days and headache hours per month. So in October of 2010, the FDA approved Botox for the treatment of chronic migraine, and all the headache specialists around the country, I can tell you, were thrilled because we now had something that was the first FDA-approved product for this particular disabling subset of migraine patients.
What is it about the Botox that works on the migraines?
Yeah, like a lot of things in medicine, we're not exactly sure. We know from the studies that it does work, but when you get to the why, that's a little gray. We know that under the skin, in areas where we inject around the head, neck, and shoulders, there are pain nerves, and we think that the Botox gets into the pain nerves and somehow prevents pain nerve transmission into the brain. When somebody is injected with Botox and they respond, they're going to get about 8 or 9 decreased headache days per month, about 40 hours of headache freedom, and this lasts about 12 weeks. So patients who respond come in to see me about 4 times a year for their injections.
Okay, that was my next question. How often does this have to happen? So when somebody gets a migraine, they don't come running to you. These injections last for a while. Is the Botox injection the same as it would be done for cosmetic purposes? It's the same thing?
No, it's actually, it's the same product, but it's injected in different areas of the head. For example, it's the forehead, but also the side of the head and the temples, the back of the head, the neck, and the shoulders. And importantly, the dose is higher, and it's that higher dose that seems to be one of the keys to decreasing the number of headache days and hours per month. In the old days, when we didn't have a good study, we didn't have the science behind us, many people all over the country were trying a number of different doses to treat chronic migraine and even other headaches, and it was through careful scientific study that we found the proper dose.
Okay, so it's the same Botox. It's not a more powerful combination, or it's not a more powerful prescription or anything. It's just in a higher dose.
That's absolutely right.
Are any side effects with this?
The beauty of it is the side effects, if there are going to be any, are generally local to where the needle goes in. So, for example, injection site pain could be a side effect, a little heaviness or even rarely a droop of the eyebrow or the eye. And the most common side effect would be neck pain. That's about 9% of people, and that's usually mild to moderate and transient. The nice thing that I tell my patients is you have a medicine that stays where it's put. So this is not going to the stomach or the liver or the kidney. It's not making you fat or tired or dizzy, etc. So it's, in a way, a very pure product for the treatment.
I know I'm coming up on time here. They're going to give me the hook any second, but anything else we need to know? Who should get these? Who should be looking at this?
So adults who have chronic migraine, 15 or more headache days a month, if they seek out a headache specialist and they decide that it's right for them, there is a wonderful website with tons of information that's called BotoxChronicMigraine.com, where patients can learn about migraine and chronic migraine and Botox, and even put their zip code in and find an expert in their area to help them out.
There we go. All right, so we'll check BotoxChronicMigraine.com. Dr. Peter McAllister at the Headache Center in Southern Connecticut. I thank you for taking some time out. Fascinating information.
It's my pleasure, Ken. Thanks for having me.
My pleasure. Take care, sir. Bye now.
Bye-bye.
Bye now.
Bye-bye.